As I have in the past and as I do now, I find myself thanking you, Rick, for this invitation to offer my perspective on diversity and inclusion. I admit I had no idea what the heck Festschrift actually meant, but once he described the intent, I was both honored and humbled. Rick is a person with a hearty laugh. Note the adjective is being repeated, hearty laugh, so don't let that fool you, since he is a person who lives and breathes his core beliefs. We have all heard of virtue and heard the phrase that someone's living a virtuous life. As others have referred, the word virtue can imply a behavior described by Aristotle, I've never quoted him, in this manner. There's no difference between fulfilling one's purpose, being virtuous, doing something with excellence, some may define as one with moral standards. I interpret the concept of virtue as it relates to the essence of a person, not representing a slogan, but rather how one lives. In reference to living a virtuous life, I read a religious weekly which stated that no one work is more highly revered than diversity. So to connect diversity as a value for doing something with excellence is based on the concept of respect and acceptance. I am someone who represents being diverse because I am. I see my surroundings based on my personal lens of being a woman and a Mexican American having been raised in South Texas. I choose to live and work in an environment where the concepts and the reality of diversity and inclusion exist, an environment in which colleagues should be able to work together and transcend those who don't believe in these concepts, help them understand how diversity and inclusion directly impact those we encounter. I grew up with the reality that everyone I knew was Catholic with an occasional Baptist and Mexican American growing up on the south side of a small South Texas town. The railroad tracks separated the Anglos from the Mexicans. As one of 7 children, we were pushed and expected to excel in school. My mother, Anita Sylvia Flores de Garcia, had a mantra. You can be anything you want as long as you have an education. Education levels the playing field. Let me help you understand my mother's lens. This is a woman who, when she first started school during a time when discrimination and prejudice was the norm in the late 1920s, was forbidden to speak Spanish when essentially Spanish was her primary language. She was instructed to sit in the back row with the other Mexicans. She was strong-willed, which I have long since discovered is quite a dominant gene within my family. Even as a little girl in a difficult environment, my mother quickly learned English and adapted to the system. She never spoke of what may have been transpired, nor the impact that may have wounded her, yet she refused to yield her dignity to such endemic practices steeped in ignorance. When she entered her last year of high school, she enrolled in a class that she needed to meet the minimum requirements for graduation with future plans for nursing school. She entered the classroom and sat at a desk in the front row. The teacher demanded that she remove herself from that desk, told her that she could not sit in the front row and that she had to sit in the back row. My mother got up from the desk and, without uttering a word in response, left the classroom, with the teacher following her, demanding that she return. Her father, a World War I doughboy and businessman, was summoned to the school and confronted with my mother's rebellion. He asked my mother what had transpired, and she told him. My grandfather looked at the principal and stated that his daughter did not have to suffer the indignity of the ignorance displayed by the teacher, demanding that my mother be permitted to withdraw and enroll with a different instructor, thus completing qualifications to receive her high school diploma. Her father protected her, preserved her dignity, as well as registered his disgust over an institutional culture that allowed such conduct. My brothers, sisters, and I didn't learn of this experience until later in life as adults. When asked why she didn't tell us, my mother explained she did not want us to feel her indignity for fear of indoctrinating a predisposition of hate or anger toward those who practice such conduct. She lived her virtue of inclusion and diversity with the hope of betterment of relationships amongst all cultures and races, and as such could not be achieved by instilling anger or hatred in her children about such practices. Although she too made choices as a young woman, such as the decision to withdraw from nursing school to make it her mission that each of her children should have every advantage that life had to offer based on the belief that this could only be achieved through education. She did not regret. She modeled patience and understanding when at times there were none. She worked to build on a culture welcoming others and treating others with dignity and respect, recognizing and embracing those around her a resolve for acceptance, in essence, placing value on diversity and inclusion. Now, some may claim diversity fatigue in our current environment, where many feel like they're walking on eggshells. To the contrary, I suggest as that we work and live, a diverse and inclusive environment feels rich, welcoming, and robust when surrounded by people who can offer varied insights. We can create a respectful, inclusive environment without fear of subtle rebuke through demonstration using poor behavior. I do not attempt to proselytize and must state that we cannot continue to marginalize underrepresented minority populations by defining diversity as success by utilizing data related to globalization and global integration. For those of us indoctrinated within our academic environments, we must remain vigilant to be responsive and seek the means in order for underrepresented minority populations to grow and develop along pathways where one can challenge and succeed in professions that define oral health as part of total health, not limited to dentists, but including all of our allied and oral health professionals and healthcare team members. We must create a network and an environment in which a person can be appreciated and included as a welcome colleague versus a token presence. Being a token presence contributes to creating additional harm to those repeatedly marginalized. Simply having someone present from an underrepresented faction does not equate to having a level playing field. As Abraham Lincoln said, that some achieve great success is proof to all that others can achieve it as well. So for success to occur within our professions, education should level the playing field as a start. I heard this in action and learned similar messaging from Dr. Vincent Fulgenetti, Chancellor of the University of Colorado Health Science Center, when in about 1995, he invited me to help recruit young Hispanic students to consider health sciences education. I joined Dr. Fulgenetti in the drive from Denver to Southern Colorado, where we met with high school-age young adults. As a pediatrician educated at Temple University in Philadelphia, he knew and worked with children and families raised in difficult conditions. He encouraged others not to only work hard, but realize that one simply cannot be selected to challenge the rigors of higher education that you're not ready for, but rather you need to seek, learn, and earn the education that makes you ready to be prepared to excel in educational opportunities. He told the young students, if you have the qualifications and are one of the people we will choose from, why wouldn't we entrust you to meet the challenge, in this case, to successfully complete medical or dental school? Why shouldn't we look broadly to be inclusive and build a diverse healthcare workforce in order to engage and help you to be a fellow professional? As General Colin Powell once stated, and I paraphrase, there are no secrets to success. It's a result of preparation, hard work, and learning from failure. It doesn't become reality through magic. It takes sweat, determination, hard work, and persistence. Through the efforts of Dr. Jean Sinkford, a cherished role model in academic dentistry, she brought Dr. Lewis Sullivan to present at one of the earliest interim IDEA meetings. Dr. Sullivan served previously as Secretary of the U.S. Department of Health and Human Services under President George H.W. Bush's administration and was founding dean for the Morehouse School of Medicine. In 2004, he presented the Sullivan Commission on Diversity in the Healthcare Workforce report entitled Missing Persons, Minorities in the Health Professions. He clearly states, quote, there is an imbalance in the makeup of the nation's physicians, dentists, and nurses, unquote, which in effect contributes to the gap in health status and impaired access to health care. So what can we claim as a result of the recommendations to address the stark reality noted? And I add the need for both increased minorities and women. Do we have the flag of success flying as a result of major accomplishments achieved over the past 15 years since this report? The most recent IDEA snapshot publication highlights data on dental student populations, showing women now comprise 49.8% of the 2017 enrollees in dental school. When you When you review U.S. Census data regarding minorities amongst those in dental school, we have by comparison 5.1% Black African American in dental schools as opposed to 13% in the general population. 9.4% Hispanic Latino versus 18%. 0.1% American Indian Alaska Native versus 1.3%. This doesn't include further elaboration on Asian, Native Hawaiian, Pacific Islander, nor 2 or more races. We continue to lag behind having our dental student population reflected of the general population. When you dive into data-rich sites such as Prosperity Now scorecard, the pipeline challenges continue when data shows a perpetual gap in existence since people of color have lower rates of college attainment. We shouldn't despair, but should question if we have really made significant strides since the Sullivan Report. When you read the report to any depth, faculty and leadership roles within academic institutions should be concerning as well when considering scholars, researchers, faculty, and senior administrators reflecting underrepresented minority population. The face of our profession is what is perceived when potential students visit our school. The diversity of faculty, diversity of staff, and overall face of key leadership of the school, which can contribute to the perception of a welcoming, inclusive environment. Think about the informal messaging you experience when walking into your front entrance and what is perceived. Simply stated, it's not enough to have photos on brochures, since the brochure does not always reflect what really exists. Based on the most recent ADIA data focused on faculty URMs, African American Black full-time faculty comprise 4.9% of 13% general population, Latino Hispanic 8.6%, Native American 0.2%, which that means 11 people. The numbers of women include about 39% full-time faculty, 33% of part-time, and a recent count, a little over 20% of US deans. Beyond basic numbers just stated, I hesitate to inquire the scarcity of URMs identified by titles such as department chair or associate dean. So to paraphrase Chancellor Fulgenetti, why shouldn't we look broadly, look beyond to engage you, a qualified URM, to join the ranks, to be a fellow professional? All other factors being equivalent, with education leveling the playing field, we should seek to include colleagues from diverse backgrounds to enrich our thinking, our decision-making, tempering our biases, and create the welcome environment which we state we support to include many others. I suggest we continue to embrace the values of diversity and inclusion, build an enhanced vision with global integration, but we need to refocus and continue to seek greater URM representation within the ranks of faculty, students, staff, and show true commitment to include URM representation in all levels and areas of leadership. This will require further work penetrating middle school and junior high school years to capture those young people for our future. Living a virtuous life has at its core diversity and inclusion of all, including URM and LGBTQ communities. Arguably core values of Rick Valachovic, perspectives he embraced and moved forward during his years as the president and CEO of ADIA, collaborating and motivating all of us to support collective success within our allied and dental academic institution. Using Rick's words, continue the relentless pursuit.